Black man in the back.
Yes, Chairman, thank you for the opportunity to talk about the public safety and our requested budget for next year. Go through the PowerPoint. 2012 budget for public safety. We have compared to our 2013 request, the salary and wage request is over $20,000 less than the 2012 budget, and our operating expenses that we're requesting is just over $74,000 increase over last year. And as we go through this, parent why those changes are required. 2012 Department of Public Safety saw several big accomplishments. It was very good year for public safety. We were able to complete our physical expansion of the Communications Center, which was no easy task. We started that program just before Hurricane Irene hit. So it was delayed while we made changes to lessons learned from Hurricane Irene. We successfully transitioned 11 municipal agencies over to our county dispatch, which again was no easy feat. We didn't have the dispatch consoles to accommodate these extra towns, but as you know, because of the sudden closure of Overlook Hospital's dispatch center, towns were looking to us to solve their dispatch problems, and we were able to accommodate them in a very short period of time. I just received a letter last week that our county police has passed their fleet inspection and has been recommended for accreditation through federal police. It's the accrediting agency for law enforcement. And our county EMS had a banner year. Almost 1,500 calls and 244,000 in revenue. And we were able to cover our expenses and treat 287 patients, Union County residents that didn't have insurance and had no qualifications. Our ME's office had some substantial changes. We reduced staff and brought in per diem forensic pathologists on a working basis to cover for the reduced staff. And we were able to reduce that budget again in our request, and that's 3 consecutive years that we were able to reduce the operating and salary expenses in the medical examiner's office. These are the requests that we're making for 2013. And again, that salary and wage request is less than what we had last year, and our operating expenses just slightly more. Our initiatives for this year, just as Director Secretary talked about very briefly on accreditation, certainly after the last 2 years of Hurricane Irene and Hurricane Sandy and that winter storm we had. There's been a big focus on emergency management and just the important work that they do, and we want to optimize that division within public safety. So we're assured that things will run as efficiently as possible. And part of that process is to bring outside assessors in from different parts of the country and review our operation.
The emergency management accreditation program is very similar to the law enforcement accreditation program, where you have to meet certain standards in emergency management. There are 64 standards that you have to provide what they call proofs for, which is basically evidence that we have met those standards. They include, and I won't go through obviously all 64, but just an overview. They're looking at prevention and security, laws and authorities, mutual aid, operations and procedures, training, exercises, hazard identification, risk assessment, planning, communications, and warning. Just a quick overview of some of those standards that we will be asked to provide proofs for. Obviously, as the director stated, this is something that we believe belief in. In the last 2 years, with all this activity within emergency management, we feel this is a very important step to ensure that we're providing the best emergency management service to the residents.
In addition, in 2013, we're looking to implement the New Jersey Public Safety Interoperability Communication System, and this is a really good deal for public safety agencies. It will be the first time that all three disciplines, police, fire, and EMS, have an opportunity to go on one common communication platform, which the federal government and local municipalities have been working on since 9/11. We will want to continue to improve coordination of our emergency services through our dispatch center for both fire and EMS, as well as police. And we really want to focus on increasing weights and measures enforcement to protect our customers in Union County. The budget comparison sheet that's up now for the director's office, you can see a decrease of $115,000 and change, and that's basically related to the lab director last year. There was no civil service title for lab director, so he was temporarily assigned to my office along with his salary. And since civil service has established an appropriate title for his position, he was moved to the prosecutor's office. Weights and measures see an increase in salary related to contract negotiation, additional hours worked, and a focus on those law enforcement activities. We'll say that last year those salaries were offset by the Weights and Measures Trust Fund in the amount of $174,961. Also included in that increased number was consumer affairs personnel that were transferred there when that department, those two departments were merged. The consumer affairs budget was combined with weights and measures, so that was a reduction of $104,000. As I said, the medical examiner's office has, for the last 3 years, seen a decrease rather than 2 full-time pathologists. We are currently employing 1 full-time pathologist and then a staff of per diem pathologists that are board certified in forensic pathology to cover that additional time. Emergency management will see decreased salaries and operating budget. The police salary and wage, we're requesting an increase there to be offset by revenues that we're going to bring in from municipalities for dispatch services. We have contracts for next year of about $350,000 from municipalities that we'd like to offset the additional dispatch costs. And other expenses, when Overlook Hospital, when they had a dispatch center, they coordinated our EMS mutual aid program. It's separate and distinctly different than our EMS mutual aid project that was undertaken last year. This is really a coordination of all the EMS assets throughout the county in case of mass casualty incidents, and the Overlook had picked up the maintenance fee for the computer systems that helped with that coordination of EMS assets. Being that they don't perform that function, it's an expense that we're requesting to be included in the function.
But are the police salaries just as a result of the contractual? Are they contractual or are they? decreasing it, just looking at the salaries of the police, it was up 276,000, is that really practical with the funding?
New position, dispatch.
Oh, they relate to this one. Some of it must be.
Additionally, it's the 3 days that the police department was willing to give up last year, so now we have to, that ended as of 12/31, so now those 3 days that they went without last year are now back into the budget at 100%.
Question.
Chairman, the Director, the line item for 2012 for overtime, 690,000. Approximately, how much of that was used in 2012? Did we exceed that budget? Was there leftover funds in that account from the previous year?
No, that, we exceeded that budget by about 70,000. In our salary and wage account, because of vacancies, had a balance of about 56,000.
How much of that was attributable to the storm last year? Do we have any idea? Any breakout? What was drawn like directly to the hurricane versus what was normal operation?
Yes.
I believe.
We did not charge the Sandy-related expenses for overtime to the departmental budgets because they could not absorb it. We charged that to the emergency appropriation for Sandy.
Okay, so that 690,000 is general operations for
That's
last
correct.
year? Okay, all right, thank you.
Sir.
I don't know if this question was just answered, but I'll ask it again. For the salary, the $276,000 increase, that's for new positions in the dispatch center. How much of it is contractual of that total? None? Or you don't have to?
None of those are contractual increases, sir.
So what's,
The driving factors are the new positions that are requested in the budget, coupled with the 3 days that the PBAs gave up last year in order to avoid layoffs. Those 3 days are now rolled into the 2013 budget because they only gave up the pay for those 3 days in the 2012
so
budget.
the impact of those 3 days is roughly,
It was roughly 75,
70, yeah.
$75,000.
thank you.
Okay. We finished or?
No.
For Fearless, rather.
Yes.
Net from overall salary and operating expenses for 2012 compared to 2013 was how much?
Budget went up $53,000 overall for.
Overall, 53,000.
Yes.
And you have what I consider substantial reductions. I mean, director's office 118,000. You had emergency management 109,000 reduction. These, you guys ate it up by 356. You have substantial reductions in other departments.
And in addition to that, we have revenue streams in 2012 that we didn't have in previous years. Certainly EMS wasn't getting its full stride in its revenue, and we didn't anticipate any additional revenue for dispatch services in last year's budget, which anticipated revenue was for a 2013 budget was 300,000.
On the area of grants and other additional funds that are not part of this, but still use that in terms of the overall operation of the department, how much money would you say that, what did you last see show anywhere here or not?
Are you asking stuff?
No, we charged the grant.
We have about 22 positions that are grant or trust funded.
In the same token, earlier we asked for an overall affiliation of all where the dollars are coming from. Would you be able to provide us with the whole department as well? Because I think overall, I understand, yes, we do get those grants, but the potential of us losing some of those grants is a reality. So we have to be ready as to how we should be looking at those numbers.
And if I may add to that, we saw that in our health department, our CHI grant. and Links grants were both reduced. That's one of the reasons why we went into the shared services contract with Middlesex County for epidemiologists. We have a opening vacancy in environmental enforcement that we have to build in anticipation of further cuts in those grants. But I would agree, certainly something we have to keep on our radar.
Sure. In the emergency management accreditation program, how much is that going to cost?
We received a grant from the state to cover the costs. Maybe Director Schuler.
The accreditation process, the application having 17 come out is about $15,000 to e-applicant the emergency management accreditation program.
That's what it will cost, $15,000.
I'm sure there would probably be some other incidental costs. We're anticipating incidental costs at about $5,000. So overall, maybe around $20,000. But we believe that $15,000 number is
Who's doing the environmental checks now with all this thing about idling trucks and everything else? Where's that come from? Which department is handling that in your department?
the environmental enforcement officers in the health department.
So the health department, this is health department salary?
Yes, and then that specific grant is for overtime for those investigators to come in early morning hours to do that surveillance and enforcement.
How many people is that in the health department?
Two.
Any other questions? Chairman Clark?
I just have very quick, and I think you probably answered it when you talked about the medical examiners. But when I look at all of your expenses, where I see decreases in salaries, I'm seeing a decrease in overtime and a decrease in other expenses. Where I see increases, I'm seeing increases in those same two areas. But in your medical examiners, I'm not. I'm seeing opposite. I'm seeing a decrease in salary and upswing in other expenses. Can you just give me what's embedded in that a little bit?
Certainly, Chairman. When we went from a two-pathologist office to a one-pathologist office, we hired additional part-time forensic pathologists that are on contract with the county to provide services. And that's the additional money that you see in that budget request, is to cover those additional expenses. Certainly have a part-time pathologist instead of a full-time. Those pathologists don't have benefits that are paid through the county and don't have fringe costs. So we'll see a substantial net savings from going through the system, but our operating expenses related to those outside contractors coming in are just going to increase slightly.
Okay. And you had said that before. I just wanted to make sure that that was what that was correctly related to. Okay, thank you.
Questions, anyone?